This video provides a brief introduction to the role of histone deacetylases in human health and disease. As we have discussed previously, HDACs are the eraser molecule for histone acetylation marks and remove acetyl groups from histones. By doing so, they change the charge of the histone proteins, making it more positive and thus strengthening the interaction with the negatively charged DNA. This strengthening interaction typically leads to lower accessibility and a decrease in transcription. Because of their function at many target genes, HDACs have been linked to a variety of human diseases. They include, among others, several cancers, neurological diseases, and even metabolic disorders. To exploit the role of HDACs in these diseases, HDAC inhibitors have been developed, just like the research community developed inhibitors for histone acetyltransferases and bromodomain reader proteins. Several of the HDAC inhibitors have received FDA approval and are actually in clinical use. All of these drugs are used to target cancers, including several lymphomas and myelomas. A variety of other inhibitors are being studied in animals or in early phase clinical trials, again with much work focusing on the role of HDACs in cancer. As with inhibitors of histone acetylases and bromodomain reader proteins, targeting specific individual HDACs without affecting others has proven difficult. In addition, the impact on non-histone targets of the HDAC sometimes leads to unintended consequences. The sirtuins are a distinct class of HDAC that are of great interest to the field of medicine. Sirtuins, or the homologs of the yeast sirtu HDAC, have been linked to longevity in a variety of model organisms, where high levels of sirtu lead to increased lifespan. Sirtuins comprise the class 3 HDACs, and in contrast to all other HDACs, need NAD+, not zinc, as a cofactor. Because of their different mode of action, sirtuin inhibitors are a different class of molecules than the HDAC inhibitors discussed so far. Some of these inhibitors have been used in clinical trials, but none have been FDA approved. Target diseases are a variety of cancers and neurodegenerative diseases like Huntington's. However, one problem that has to be considered when utilizing sirtuin inhibitors are potential negative impacts on lifespan, which will require long-term study. In summary, HDACs have been linked to a variety of human diseases. Like the other molecules responsible for the regulation of histone acetylation, histone acetyltransferases, and bromodomain reader proteins, they provide promising drug targets for the medical field. Several HDAC inhibitors have been approved by the FDA for the treatment of cancer. Inhibitors of the sirtuin type HDACs are more difficult to use in the clinical setting as these proteins have been linked to lifespan.